Hi, my name is Javeed Sukhera. I'm a 2015 AMS Phoenix Fellow, and my work focuses on stigma and the experiences of individuals who suffer from mental health concerns in our healthcare system. There's been a lot of work on reducing stigma, whether it's social or within healthcare workers, but one of the biggest limitations of that work is that oftentimes individuals that might have deeply held beliefs really aren't moving the needle forward. So my work is unique because we focus a lot on self-awareness for healthcare providers. We really center our intervention around this idea of implicit stigma. So what are those unconscious attitudes that we have about patients with mental illness that are even outside of our conscious awareness? This approach is really important because a lot of times very well-meaning, well-intentioned physicians and health professionals may stigmatize patients without even knowing that they're doing it. So in the interventions we've implemented through the support of AMS Phoenix, we've been able to sit down with physicians, nurses, learners, and help them become more self-aware in order to be able to break down stereotypes and improve the system and experience for patients and their families. The workshop is really an opportunity for these providers to step back from their day-to-day clinical busy practice and really think about the experience of the emergency department through the lens of patients and their caregivers. So the educational interventions that we've implemented focus more specifically on implicit stigma, so the stigma that we carry in healthcare that's outside of our conscious awareness, which is so important because no matter what our consciously expressed goals might be, those underlying unconscious attitudes that we have towards patients and the labeling that occurs really has a negative impact on their experience. The good news is that patients, caregivers, providers all agree that the current system needs to be better, and they all agree that the best way to foster that is just getting back to those core communication and empathy skills that all of us learn. Really focusing on the patient-provider relationships and remembering that the best way to counter stereotypes is through human exchanges, dialogue and discourse. Exploring things that might seem uncomfortable is the only way to move the conversation forward and break down some of the barriers that we've created in our system.